Hello and welcome to everyone. This is Dr. Eduardo, senior attending physician at World Stem Cells Clinic here in Paradise, Cancun, Mexico. I hope you all are safe and sound watching us at home, and hope all of you and your beloved ones are safe from this pandemic we're all going through. And well, again, thank you for being part of today's webinar. Today, I will be talking about regenerative medicine for pulmonary disease and the therapeutic approach and potential of the mesenchymal stem cells. Now, I will be talking mainly about COPD condition, but first of all, let me talk or guide you through a little bit about our information, who are we, and about our two companies. We are World Stem Cells Clinic and Rehealth Clinic. We are a company based in the US, but we offer therapies here again in Cancun, Mexico. The mission of our company is to share and apply our experience regarding the use of stem cells and cell-derived products as adjuvants in the treatment of different diseases or conditions. We also own our own bank of stem cells, we also own a blood bank and a cord blood tissue bank as well. And we offer other than COPD's therapies and a bunch of other regenerative medicine therapies for conditions such as Crohn's disease, multiple sclerosis, lupus, Parkinson's, diabetes, ortho and sports injuries, strokes, and so much more. If you are interested about the use of stem cells or about our protocol or any question at all regarding either today's lecture or the use of stem cells, feel free to send us an email, give us a call, or simply ask me your questions at the end of today's lecture, and I'll be happy to take care of your doubts. Now, the objective of today's webinar is, well, first of all, you're now hearing about us. We are here to help. We are World Stem Cells Clinic and Advanced Biomedicine. And we will be talking today about COPD. So I want you to understand what's this condition and the therapeutic potential of the mesenchymal stem cells for COPD. The definition also of what's a mesenchymal or stromal mesenchymal stem cell, and I will show you some reports of clinical investigation and the therapeutic potential of the cells in patients undergoing lung disease. Now, regarding our processes and affiliations, we are fully certified by good manufacturer practice, and we are also certified with good tissue practice by FDA, which is the organization related to health in the US. We are also fully certified for providing this therapy here in Mexico by the Mexican FDA, which is called COFEPRIS. And our laboratory is built under clean room standard by ISO 7, the International Standard Organization 7 protocol, and we're now affiliated to ReStem, which is a company offering stem cell therapies mainly for COVID. Right now, they have shown having very good response in stopping the progression of COVID infections and also helping in patients undergoing very difficult or severe symptoms of COVID. The use of stem cells has stopped the progression of the condition and also has limited the side effects such as the scar tissue forming in the lungs in these patients affected. ReStem is a company that is offering this therapy in the US by the Hospital of Miami and South Dakota. First of all, let's get started with the definition of what is COPD. COPD stands for Chronic Obstructive Pulmonary Disease and can be described as a group of lung conditions, mainly chronic bronchitis and emphysema. Nevertheless, in some cases, um, asthma is also a condition involved. Now, this chronic obstructive disease can be described as a group of conditions like emphysema, bronchitis, and asthma that inhibits the body ability to remove air from the lungs. COPD can lead to symptoms such as fatigue and shortness of breath, and more severe symptoms or bunch of other signs and symptoms that I will discuss later on this webinar. Now, it's highly important to keep in mind the relevance of this condition as it's the third leading cause of death in the US. Now, this is not a condition that just affects the US. In 2020, actually this same month, there was a study released by an American company. And this study stated that around 250 million new cases of COPD were diagnosed worldwide, of course, and COPD is the cause of nearly 5% of all the deaths around the world. That's the relevance of this condition, which for some patients is taken not that seriously. The COPD condition is predominantly diagnosed in middle-aged individuals, usually older than 40 years old. This doesn't mean that cannot affect a younger patient. We have seen and treated patients in their 20s, actually, who were heavy smokers at the beginning of their 20s, and they're now already suffering of chronic obstructive pulmonary disease. Now, let's talk a little bit about the gas exchange and the anatomy of the airways. Now, the gas exchange happens this way. As soon as the air goes into the alveoli, which is, I don't know if you can see my pointer right here, but you can look at the top image on the right. Those little sacs, let me see. With this laser point here. As soon as the air goes to the alveoli, which are these tiny little sacs at the end of the bronchi, the oxygen in the air goes through the walls of the air sacs, then into the blood through the capillaries, which are these little terminals of the blood vessels. And at the same time, carbon dioxide goes into the alveoli sacs coming from the capillaries. And that's how the oxygen and carbon dioxide interchange or gas exchange happens. When you breathe, the air travels down the trachea into the lungs. All this way, we follow the trachea, and then it goes to the lungs from these two secondary tubes called bronchi, which will divide later on in a bunch of smaller tubes that and in tiny little sacs, which are these alveoli, okay, which is where the magic happens and the interchange of gases happens. As I just mentioned, the elastic nature of all of these tracts, starting from the trachea, the bronchi, and the alveoli, helps the air to get out of the sacs of the alveoli and force the air out of your body during respiration. But COPD will cause to lose the elasticity of the alveoli of the bronchi and the lower tract of the trachea, making it more difficult for the lungs to expel the air. And this will cause trap of the air in the lungs during exhalation, making more difficult during the next time you inhale to do the gas exchange. Hopefully I'm making clear this point. If not, please let me know at the end of the lecture. What's causing COPD? The primary cause great majority of all of the patients affected by this condition is because of tobacco smoke. It can either be a direct use of tobacco smoke or secondhand smoke. COPD may also be caused by other environmental factors such as exposure to dust, air pollution, and airborne chemicals. This might lead to chronic inflammation in the form of thickening of the bronchial walls, which I already tried to explain in the previous slide. But right here, you will notice with this more graphic example, that at the top right of the slide, here where I'm pointing, this is a healthy or normal bronchia. And this is a bronchi, or the way you will look at bronchi who is affected by COPD. As you will see, the inner space of the bronchi is completely narrowed, and it's also filled with a lot of mucus, because these patients are constantly coughing and overproducing more mucus than usual, and which even complicates the process of gas interchange as well. Now, the most common signs and symptoms of COPD will be, number one, the shortness of breath, but we also have the smoker's cough, which is another name of persistent coughing or coughing that produces a lot of mucus. Labored breathing especially occurs during the mornings, and during physical activities or physical stress, such as playing any sport, climbing the stairs, or again, performing any type of activities. Depending on the stage of the patient, it can be a no limited condition up to a highly limited condition in the lifestyle of the patient, to the point of not even being able to do basic activities such as taking a shower on their own, because they get tired very easily because the effort of trying to breathe. I'm sorry, I switched slides. Let me go back again. Okay, another symptom is having wheezings or strange sounds while breathing, a dry, sickly whistling or sound when exhaling the air. This usually indicates an early stage of COPD. Also, frequent tightness in the chest area is an early warning of COPD, and persistent cough that usually occurs during the mornings. And this is related to a chronic airway inflammation that it gets worse while you're laying down as you're flat, and the airway is even blocked more because of the mucus, and the thick viscous mucus overproducing, that is being overproduced. I'm sorry. And although many COPD patients notice such complaints, like the difficult breathing or the shortness of breath or the wheezing or the cough, they do not take them very seriously. And usually coughing is the first symptom, but initially not noticed by most of the people, or they don't think this is an alarming symptom. And people who are not very physical active may only recognize COPD when it has reached to a point when it's so advanced that it affects them even when they are in rest or they're resting. Some researchers have also found that many heavy smokers already have COPD, but they just haven't been diagnosed because they might not feel any manifestations until it's confirmed by a lung functioning test, which is the spirometry. Having COPD can also damage your body's defense mechanism, resulting in frequent colds or other respiratory related infections, such as influenza, for example. That's the reason why it's highly recommended to get assessed and addressed by your pulmonologist in case you're suffering of any of these symptoms. He might ask you to keep yourself up to date in your vaccine program, receiving your shots of influenza and pneumonia year by year. Now, COPD symptoms worsen, the patient requires more effort to breathe, so it gets harder and harder to exercise or perform any routine activity, like I just said, like going upstairs, climbing the stairs for going upstairs, or even a simple fact like getting dressed. It gets extremely difficult for them and makes them so tired that it's very limiting their quality of life. Now, the mechanism underlying the airflow limitation in COPD is inflammation. Let's put it in simple words. It's inflammation. And well, let's just not forget about the excessive production of mucus as well, causing a bulb effect, making it even more difficult to do the gas exchange. Now, inflammation will cause, a chronic inflammation will cause, I'm sorry, will cause small airways disease, and which is again the narrowing of the tubes of the alveoli and the bronchi, and parenchymal dysfunction, which is a change in the epithelium of the inner layers of the bronchi, alveoli, and the stiffening of them as well, as scar tissue is formed through chronic inflammation. Okay. Now, this image is to amplify, to show you the three main values that we look for in order to diagnose a patient with COPD. A normal person with lung is well balanced in terms of IRB, VT, and FRC. I'm sorry. ARV stands for inspirational reserve volume, VT for tidal volume, and FRC for functional residual capacity. Now, in a normal person, again, these three values are completely balanced, and in a person affected with COPD, they are completely unbalanced. With just a tiny amount, as you can see, well, right here, this is normal. This is a normal lung, but you will see from next slide how the IRB gets highly restricted with just a tiny capacity of IRB, which is limiting the exchange of oxygen. Like right here, this image represents exactly what I was trying to say. As you might see, this is a normal person. IRB is this size, and right here, IRB is very limited, restricting the oxygen interchange, gas interchange, I'm sorry. Yeah, of course, because the air gets trapped in the lungs and make it more difficult for appropriate gas exchange. And as I just mentioned, the gold standard for diagnosis is spirometry, which consists in a study, a breathing study. The doctor, your pulmonologist, or the technician will ask you to breathe deeply and exhale, inhale and exhale, forcefully exhale the air through this tiny little tube that is connected to either an app or a software program in a computer or in a machine that will give the doctor a lecture that will help him determine if the condition is related to chronic bronchitis, emphysema, or asthma, or the three of them at the same time, or two of them at the same time. Again, the most common affection is a mix of emphysema and chronic bronchitis. This is the gold standard for diagnosis. And respiratory infections can worsen COPD. That's why in a few slides ago, I was mentioning that you need to keep a close contact with your pulmonologist or with your practitioner if you are suffering of any of these symptoms of restricted air exchange. respiratory infections by their own, like influenza or pneumonia, do not cause COPD. But if you are suffering of mild or severe COPD, this might turn into a highly life-threatening condition, which you do not like to experience. So it's always good to consider the visit to your pulmonologist if you are suffering of any of these symptoms. Now, can your lungs heal from COPD? Unfortunately, no. There's no actual cure for COPD, but that's the reason why we're here. That's the reason why we will be talking about the positive outcomes when the use of mesenchymal stem cells. Again, there's no cure, but treatment can help ease symptoms, lower the chance of complications, and generally improve quality of life. Medications, supplemental oxygen therapy, surgery, and now the mesenchymal stromal mesenchymal stem cells are some forms of treatment. The mesenchymal stem cells, what are them? What are the mesenchymal stem cells and where do we obtain them? Number one, mesenchymal stem cells are adult stem cells isolated from different sources that can come from, for example, bone marrow, adipose tissue, from teeth, from umbilical cord tissue, or amniotic fluid, for just stating some examples. Now, mesenchymal stem cells or stromal stem cells can differentiate into many different cell types within the body, including bone cells, cartilage, muscle cells, neural cells, skin cells, and corneal cells. For example, where do we obtain these cells? In our case, here in this company in World Stem Cells Clinic in Rehealth, the way we do it is that we scratch an inner layer right here. We scratch an inner layer of the cord tissue. This is a regular cord, umbilical cord tissue. And the place where we obtain it is from the cordon layer, the cord layer in between the amniotic epithelium and the Wharton's jelly. So it is what is at the top of the Wharton's jelly. So we scratch part of the Wharton's jelly, and there is where we obtain the mesenchymal stem cells. Why we do it this way? Because umbilical cord cells have been proved to be the youthful cells that we can obtain, and also these cells tend to replicate at a faster rate, and they have the ability not only to differentiate into other cell types, but also to multiply and to increase their healing effect on the body. Okay, let's go back. All right, this image is just to amplify how the multipotent effect or potential of the mesenchymal stem cells to turn into several tissues, as they can turn or change into any pretty much any cell type in the body. But most important is the factor that stem cells help us modulating the immune response to inflammation, modulating the cascade of inflammation of the body. That will help us controlling the inflammation that is going on in the alveoli that we discussed during the first slides. Now, for being called a stromal or mesenchymal stem cells, they need to cover certain factors such as test positive or negative for certain markers of expression. For example, again, for being called stromal mesenchymal stem cells, they have to test positive for markers such as CD90, CD73, CD29, 105, and CD44. And they also have to test negative for CD45, negative for CD34, 14, and 11B, for example, and 79 alpha. Okay, I have them right here. This will make it more clearly. The stem cells, again, in order to call them that way, will have a proper the ability of adherence to the cell plate. So they will, by their own, adhere to the layer, the plastic layer of the cell plate. Okay, that's their nature, and also they must test positive for these markers, for example, and negative for all of these markers right here. And well, we already know the multipotential differentiation, the multipotent differentiation of uh, multi-differentiational potential of the cells, I'm sorry, that they can turn into pretty much any cell type. Now, okay, we already went through this slide. The safety regarding the use of mesenchymal stem cells. The mesenchymal stem cells have been in the market for the past 10 years or even more now. And these cells are completely immunoprivileged. What am I trying to say with immunoprivileged is that they, by their own, do not cause any allergic response in the body where they're being refused. And that makes them impossible to reject the body that is receiving the cells to reject them. Okay, nevertheless, the media where the cells are growth in the lab contains some proteins and growth factors that in some patients, as well as some antibiotics to avoid the growth of bacteria, of course, while they are being cultured in the lab. And for some patients, either these growth factors, the proteins or of the media, or the antibiotics could cause an allergic response if they are allergic to these antibiotics. Like myself, I'm allergic to cells that are exposed to gentamicin, for example. And nevertheless, in all of our patients receiving mesenchymal stem cells from cord tissue growth in our lab are completely washed in 3 different steps to take off pretty much all of the factors that were exposed, the cells were exposed during their growth, like again, these proteins and this media and the antibiotics. And also for extra security in our protocol, we always offer a pre-medication to the patient with some antihistaminics and these antihistaminics will help us to avoid any allergic response. But the cells by their own are completely hypoallergenic. Okay, mesenchymal stem cells. Okay, can you all hear me? Can you still hear me? Mesenchymal stem cells have shown the ability to avoid a negative response from a person's immune system, allowing the cell to be transplanted in a wide range of people without fear of rejection. This transplant basically increases the body's natural healing abilities to have a potent anti-inflammatory and immunosuppressive response. Well, another slide showing the benefits of mesenchymal stem cells, reducing inflammation, modulating immune cells and immune response, and immune inflammation, fighting the apoptosis and fibrosis, and improving angiogenesis, regeneration of tissues, and self-renewal, of course. Remember that we're looking here for regeneration of the damaged tissue, but most important, the immune modulation of the body, helping the body to modulate the inflammatory response in any condition. Remember that this same therapy can be used for treating several inflammatory conditions. There can be either autoimmune conditions or physical affections. The best possible way, of course. And some of the some of the pros of the mesenchymal stem cells is that they promote this anti-inflammatory environment by raising the regulatory response of the B cells, the T cells, the regulatory T cells as well, regulatory dendritic cells, and M2 macrophages, but also reducing the response of the plasma cells, the effector T cells, the natural killer cells, and neutrophils, and M1 macrophages. Now, regarding the use of the cells with COPD, when used in these patients, the stem cells can repair damaged lung tissue to combat emphysema or the chronic bronchitis. They have the natural anti-inflammatory properties that might help this lung condition. And while stem cell treatment can repair damaged tissues, is a relatively uninvasive procedure, which makes it highly attractive for patients undergoing this disease, there's no solution again, there's no cure for it. Nevertheless, we have some very success stories treating these patients. Some of them even increasing the respiratory volume by 10% in the following weeks after receiving the therapy. This is improving dramatically the quality of life. Now, the young nature of these cells allows the enormous potential for them to transform into whatever type of cells necessary within the body. Remember, the point here is always treating the inflammation and modulate the autoimmune response and helping the regeneration of the tissue. The stem cell therapy becomes even more desirable when considering the current treatment protocols or options for the patients with COPD, which might require the use of ventilators or even lung transplant, which for most of these patients will not or might not be possible because it is extremely rare to get a lung transplant and extremely expensive as well. Remember, as we are using youthful cells, cells from cord tissue, they tend to replicate faster, and mesenchymals have the ability not only to differentiate into other cell types, but multiply. As we are using youthful cells, this will increase their healing effect in the body as well. Okay, this image is to show graphically the mechanism underlying the modulation of inflammation and lung tissue repair by the mesenchymals in COPD. As you can see right here, they will modulate the inflammation by releasing or controlling the cytokines and anti-inflammatory factors, but also they will help by releasing tiny little vesicles with information that will go to closer cells, also known as exosomes. These tiny little vesicles will contain the appropriate RNA information in order to control the process of inflammation and modulate the immune response. Mesenchymal stem cells potentially act through cell-to-cell contact as well. So the mitochondrial transfer and secretion of soluble factors, either directly or through these exosomes, including growth factors, DNA, and anti-inflammatory cytokines and chemokines, is what helps improving the tissue homeostasis and ends up favoring the repairing response of the body, controlling the inflammatory response again. Let's stay with these three main things, the summary so far of the pros of the therapy with stem cells. Number one, they reduce the inflammation, which I've been saying every single slide since the beginning of today's lecture. Number two, they modulate the immune system. And number three, they stimulate tissue regeneration. Now, it's possible to help a patient with COPD with the mesenchymal stem cells when administered intravenously, as they have the ability to promote healing and regenerate by excreting messenger cells such as the cytokines and these vesicles, the exosomes. Okay, noticeable improvements in their quality of life after the therapies have been described by our patients here at the clinic after receiving our protocol of stem cells, which consists in several reinfusions of IV stem cells. Many of these patients reported even an increase in lung capacity and at the same time the ability to walk or perform physical activities that they were not capable to do anymore after their complete their protocol. These reports by our patients and patients reported in many articles that you can look out on the internet has placed this therapy as one of the best viable options for the current patients undergoing COPD, again because the options are very limited. Not everyone can receive a lung transplant, and again, we living with a limited quality of life can even affect psychologically the patients to the point of developing being anxious or developing depression. This can be a very frustrating condition by limiting the quality of life of the patients with something so physiological and which is just breathing. Okay, the goals of the therapy, like any other therapy, we're looking to relieve the symptoms, slow the progress of the disease, improve the exercise tolerance, prevent or manage the complications, and improve the overall health. And this is because we have seen that with the use of the therapy with stem cells, we have reduced the visits to the emergency room in our patients undergoing COPD, for example. And after the therapy, again, they have been able to be more physical in their day by day. Today, as of today, we do not have a cure again for COPD. We have medications that will help with quality of life as well, like inhaled medications, like bronchodilators, corticosteroids, and methylxanthines and phosphodiesterase 4 inhibitors. But again, not a single one of these medications offer an actual cure or an actual regeneration of the damaged tissue or a control in the actual inflammation undergoing in the lungs. So that's why the relevance of this stem cell therapy. Now, just to show you the safety of providing stem cells to patients, I found this image quite interesting, as it has, I don't know, like 12 15 reports of studies performed in several countries, like you can see Iran, Netherlands, Brazil, Vietnam, Russia, Brazil, US, etc. And all and every single one of them reporting that the therapy was safe and no bad side effects reported in any of their patients, which make it a pretty reliable therapy. Dr. Barthun, for example, in their article, concluded that stem cell therapy, this is for Crohn's, but applies exactly the same thing because the protocol is basically the same. It consists in IV reinfusions. The therapy for COPD, let's say, in long term, it was safe. It was a safe therapy, and the mesenchymal stem cells also have a strong autoimmunomodulatory effect, meaning that they can prevent the immune system from mistakenly respond to the incorrect threats. Now, this is from another article that I found out, the stem cell therapies for COPD. They reported that mesenchymal stem cells demonstrated positive effects in COPD and have been safe for clinical trials again. And this is like you'll find, if I find this image with just this bunch of students, it's just matter of fact that you just go through the internet and Google it down, and you'll find a bunch of good articles stating the good response to this therapy in patients with COPD. Now, this is another article by Dr. Caros, the improving effects of mesenchymal stem cells on symptoms of chronic obstructive pulmonary disease. In comparison, of course, with pre and post treatment, most or pretty much all of the patients that he studied showed improvement, considerably improvements in their quality of life, and they alleviated or considerably alleviated the severity of the symptoms. This has a tremendously impact in their quality of life, which is, again, highly important in all of these patients, as they are so limited to the point of not being able to perform their daily activities, simple daily activities, just like getting dressed, going to the restroom, taking a shower. Okay, this is, for example, one of the images shared by Dr. Kervos in his study, where he is comparing every one of the 5 cases or the 5 patients that he treated with stem cells, and every single one of them, as you can see, had improvements in their symptoms after reducing the symptoms after receiving the stem cell therapy. In the 5 cases, they reduced their symptoms and their visits to the emergency room because of complications or sudden shortness of breath. Now, the worsening of the shortness of breath, of course. And of course, there are some cases of some patients where the volume, the fraction of the volume exhaled does not show much of a difference when measured through the spirometry. Nevertheless, even in those patients who do not show a difference in the volume of the respiratory volume fraction, they showed improvements regarding the reduction of their symptoms. Okay. Mesenchymal stem cells administration also shift the balance to a more anti-inflammatory circulating cellular profile. And right here, there was a reduction in hospital admissions for acute exacerbations of COPD from 11 events occurring within a year before mesenchymal stem cell reinfusion to 6 events occurring within the following year after reinfusion. For me, wow, this is an amazing success rate, because 50%, it dropped to 50% the visits to the hospital, to the emergency room or hospital admissions. That's very good improvement. Now, mesenchymal stem cells have the inherent ability to target inflammation within the body and repair damaged tissue, which I've been saying for the whole lecture. We are done now. I look forward if you have any doubts to answer them. Let's remember that not everything that shine is gold. There's a bunch of companies stating that they are offering stem cell therapies, but they do not even offer the opportunity to have a direct contact with one of their doctors or practitioners offering this therapy. Most of these companies do not offer an appropriate quality of therapy of cells with very minimum viable cells. Now, number one, you must identify that any therapy offered in the US, unless is performed as a study like RISTEM company for COVID patients or Duke's University, if you are offered a stem cell therapy in the US, this is not a proper therapy or not the proper quality of the therapy that you would like to receive, as this is still not an FDA approved therapy in the US, meaning that the doctors cannot do any work with the bone marrow sample, or they can actually not process or work with stem cells in the lab. So the quality of the therapy that you will be receiving, if it's a company based in the US, will probably or most likely will not be the quality that you're looking for in this therapy. Please watch out for all of the misinformation going around the web or the medias. Have direct conversation with your practitioner, with your pulmonologist, or with a specialized doctors in regenerative medicine. We are open for you if you would like to discuss information about this therapy or any protocol regarding the use of stem cells or the use of stem cells in any other condition, because again, we treat several conditions with stem cells. We are more than happy to assist you, and you can schedule with us as many free consultations through the phone as you might need to solve all of your doubts. Okay. Now what we are doing here is that we want you on control over your life. We want you to take back that quality of life that you deserve, and you know there's a better way to live and take ownership of your health. And you know there's a safe and natural way to do it, and that's why we are here. This is our mission, and we are here to help. We're completely open, even if you're not willing to, or you are not interested as a patient, please feel free to share any information, or if you would like to discuss about any subject related to the use of stem cells, we're more than open, and we will be happy and glad if you communicate with us, and we will take it from there. We do not just provide stem cell therapies, we provide life-changing experiences. Again, my name is Dr. Eduardo, Senior Attending Physician at World Stem Cells Clinic and Rehealth Clinic. And well, I look forward for your opinion, your feedback, and your questions. All right, I'll give a few minutes for you to write down your questions if any of you have any. If not, this lecture will be uploaded in our website. Make sure you follow us in all of the social media, World Stem Cells Clinic. You can look for us at worldstemcellsclinic.com and rehealthclinic.com. And right here is my email address, and you will find also our direct phone number to the clinic. I might be busy if you give us a random call, but as soon as I get a chance, an opportunity, I'll give you a call back.
Dr. Eduardo, we have a question coming that says, they ask if it's safe to travel right now to Cancun, even in the midst of COVID-19.
Yeah, well, Cancun has been ranked and certified as the only or the first city in whole Latin America for receiving tourism since since outbreak of COVID. So the whole hotel strip, which has like 27 kilometers, which is like 15 miles, full of just hotels. It's open and receiving patients with all of the appropriate measures. And we have been open for the past month already, and we have been receiving patients every single week since we reopened. We will take care of you, of course. So we follow all of the regulations for receiving patients and operating with no restrictions. And we cover all of the measures needed for receiving patients and all of the certifications as well. So we are open for you. We are ready to receive you. We will be glad to have you here. Anything else?
Yes, we got another question that says, for how long does the patient gets to enjoy the benefits of stem cell therapy after receiving the IV?
That's a great question, actually. I could say that most of the patients stay with their gains after receiving the stem cells. So this is something that in some cases and some patients, they decide to repeat the therapy because the result or the outcome was so favorable that they are happy with improvements and willing to repeat it again. But most of the times with a single therapy, you will notice some improvements that most of the times will stick with you. And of course, you have to make some changes in lifestyle. If you are, for example, a patient with COPD and you're still a smoker, first of all, we have to do dramatic changes in this areas of your life, starting to quit smoking and turning to a healthy lifestyle, of course. Is there any other question?
It seems like those are the unique questions that we have so far.
Okay, although we are completely open, as I just mentioned, to discuss any further questions or doubts, please feel free to write them down whenever we upload this video, or go ahead and write us through our social media. Mrs. Michelle is taking care of all of our social media, and she will be taking care of all of your doubts and guide you guide you to me in order to solve them. Again, you can also take a picture of this last slide and give us a call anytime to the clinic, or simply write us an email if you just have few doubts, and I'll be happy to reply as soon as possible. I'm always replying emails, so I'll be happy to assist you. All right, well then, if there's no more questions, we will finish with today's webinar. I hope you like it. Thank you for being here again. Thank you for your time, and I look forward to hearing back from you. Have a wonderful day, a wonderful weekend, and stay safe. Take care. Bye-bye.
Listo. Ya
Okay.
terminé de grabar y mañana la vamos a compartir en redes sociales para las personas que no la hayan visto.
Súper, perfecto. Bueno, pues muchas gracias, Michelle.
Perfecto.
Cuídense mucho.
A tus
Saludos.
órdenes.
Hasta
Saludos,
luego, que
doctor.
estés muy bien. Gracias, gracias.
Mañana la subimos también a YouTube y
Órale.
le paso el link por si lo quiere compartir con sus amigos y así, pues ahí va a estar.
Excelente. Muchas gracias.
A tus
Hasta
órdenes,
luego.
doctor.
Ah, mira,
Hasta
espérate.
luego.
Hay una pregunta, mira.
Muchas gracias por esta sesión.
Ah, ok.
Ajá.
Bueno, hasta luego. Muchas gracias por
A sus
participar.
órdenes.
Hasta luego.
Bye.